Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
You know, I was looking, since we started this show months ago, I was waiting for this wonderful opportunity to say, last week on the last week's episode of the show, this is a follow-up. Although in some respect it's not. What we found out through the patient list that of folks that see Dr. Juliff in Vein Clinics. And by the way, Vein Clinics of Hawaii, as you know, is on 4 islands: Kauai, Maui, the Big Island, and here on Oahu. Dr. Randall Juliff is the medical director, and gets to flit from one to another with his little happy dust all over the place. And that's what we're going to do today, because we love it when things turn out right. And if you get properly diagnosed in the field that you specialize in, Dr. Juliff, you will get the treatment that goes along with your diagnosis. So you're almost able to say, you know what, if you commit, we're going to find out what's going on with you, and we're going to get you fixed. We're going to help get you healed.
Right. Yeah. And sometimes it takes a couple steps to figure out what somebody has. Sometimes it takes many more. But usually we remain fairly persistent and try to figure things out for people. And the diagnosis of the problem is as important as the treatment of the problem. You got to get both of them right.
And we're going to do that. If you were with us last week, you met Sister Joan. Sister Joan is a survivor. She's been around the block, and she's got such a great attitude. We learned a lot of things, and we sort of held off, those of you that were with us last time, we sort of held off on the actual treatment that she's received and the stuff that she's received at Vein Clinics. But we did know over a long, circuitous route, not only born, correct me if I'm wrong, sister, in New Jersey, and coming to Hawaii as a young 23-year-old nun, and being many, many, many miles away from home. You're kind of a pioneer. You're kind of a risk taker in the first place, aren't you?
Yeah.
Yeah. And just make sure that people understand what got you to move from New Jersey, where it's cold and damp, to Hawaii, where it's hot and not.
Well, I mean, hardly a bad choice.
Yeah.
No, I was assigned here in the days in the mid-50s, nuns didn't pick where they wanted to go. Mm-hmm. Now they have this long discernment of where, but that doesn't happen. That didn't happen then, no. I was at breakfast one morning, and they read a list of about 25 people who went all over the world.
Wow.
And going to Hawaii in Maryknoll was not necessarily the best place. Now, once I got here, I knew it was the best place, but, you go to South America, or you go to Africa, or you go to China. Those were the big places.
What was it? Was it common for folks like you to get to a place, an assignment, and then stay there?
Yes.
Yeah.
Yes.
That's that's fascinating, isn't it? Very much like Father Damien and many of the others.
You begin to love the people. It's the people, not the work.
Well, see, but the thing is, and Doc Juliff, we know this. When she says it's the people, what you do, it's all about people too. And yet here's somebody that is dedicating their life to helping people, and then they need some help. Which is sort of a fascinating thing. Full circle. Yeah. That's why we're so lucky to have Joan be able to join us to talk about that. So if you were with us on the last program, we learned about some swelling and some issues with blood that got cured over decades. And now we're getting to the juicy part where we find out how did Sister Joan get hooked up with the Vein Clinics of Hawaii.
Right.
So what do you know? How did you? What was your first exposure?
I think Joan's story, and we learned this last week. She's got a very, very interesting story that entails several decades, a couple of different continents.
Different countries and all over the place. Sure.
Yeah, and I think Joan's documentation is a testament to just her keeping track of the whole thing. But, to be able to go back to many years ago, she had this episode of viral pneumonia, And as your doctor said back then, viral infection often leaves a calling card. And, there are worse things that could have happened. But, people die from the, sometimes from viral infections that cause problems with other organs like the heart and lungs. But it ended up creating a lymphatic problem in you that, was shortly thereafter recognized. And again, it's particularly interesting to me because then she was seen and treated in Germany.
Which is maybe if all the places in the world you could go at that time for treatment for a venous disorder, you went to the right place.
Probably a very good place, yeah. So not only was it a different place, but it was also a different time, we didn't have, at that point, we didn't have anywhere near the, technological advancements, certainly in venous disease, that we do now. And she was treated in a variety of different ways. Some of them helped, some of them didn't. But then she progressed and came back to Hawaii, and that's where we are now.
Okay, so it seems to me, Joan, that you've got the bull by the horns. You figured this out, but I still want to know was when you finally decided, you know what? Okay, I had this and it's done. The viral that could have been a life changer, and you could have, and now you're seeing things on television, and if you're in our age group, you could have something that happened to you 50 years ago and you're going to get shingles today. I mean, they're scaring us to death here, But you seem to have such a great attitude. It must mean that you just at one point in time says, you know what? I need to get some help because I'm just not going to accept these conditions. How did you get what? Well, so was your doctor recommended?
That's when I went back to the. It's interesting. I had done a lot of work in feminist movements. So when I first came back from being in Berkeley for a couple of years and finishing my doctorate, the first two doctors I went to, my eye doctor and my primary care doctor, were both women. Mm-hmm. The first one left because she didn't like the education system here and went to New Zealand. She thought she could get better education for her children. She and her husband moved. Okay. Mm-hmm. The second woman doctor I went to was wonderful, but her mother got sick and she moved to Arizona to take care of her mother. Sure. And the third one is still sitting in Oahu prison for having done over drugs.
So that was like strike three.
Three in a row. And I went back to Cyril and I said, I was really trying to be good about supporting women in the field. The only eye doctor I kept was the only doctor I kept was my eye doctor, Dr. Jenkins.
You know what? We need to part just a second, Dr. Juliff. And by the way, a lot of this stuff, and you're going to be able to hear this episode for sure on veinclinicsofhawaii.com. Please go there and check it out anyway. Make an appointment. Come down and get checked on this. I think that, we're in the middle of an opioid problem in the whole world. Oh. And I'm saying that it's doctors when they're prescribing that stuff were probably very, discreet about it in the beginning, and then it became a nightmare. And look, we just seen another doctor that's in jail now.
Mm-hmm. Yeah,
and this was a woman doctor. And you know how I knew something was wrong? I went in, and all of the people working in her office were men, all male nurses. Nothing wrong with that, but very unusual.
Yeah.
And but that's. Each individual doctor sometimes doesn't know that the patient is going to doctor after doctor after doctor.
Now, thank goodness, in some respects, in pharmacology, you can go to, say, one drugstore, and the other drugstore is known that you went there.
Yeah. Right.
Because it's a problem.
Well, and there's a computer.
Yeah, exactly. The remedy has come about because of communication. Mm-hmm. I mean, you're right. If you go into one pharmacy, immediately everybody knows it because they have access to that information. But the opioid problem, it has been very, very long in coming along. And I think that for many, many years it was ignored. Nothing was done about it. Everybody kind of, turned a blind eye. But finally we're starting to recognize it and understand the, societal ramifications that it has. And luckily we're doing something about it.
Well, here's the thing. When we talked about the similarity to me, and the reason why I even brought it up was that if you've listened before and you continue to listen, you'll learn that the venous insufficiency insufficiency, whether arterial or in your veins or your arteries or whatever, it takes a long time to develop.
Yeah.
And therefore,
you don't treat it in a day.
Yeah. So that's kind of parallel to the experience that the world, and particularly our country, is having with these opioids, because nobody was keeping track of it 20, 30 years ago.
Right.
Now we got a bunch of addicts out there.
Yeah. And I think I don't think that everybody went into or got into having a problem like that with malicious intent. I think that
probably quite the contrary.
Yeah, I mean, people had pain and were treated, and maybe got too many opioid type medications, and turned into a huge problem.
But interestingly enough, and we don't need to dwell on this, the reason why they're a big problem today is because they're so darn good. Mm-hmm. I mean, a lot of these medications. First of all, there's a litany of 55 titles that I've never heard of before. When you Xylenta this and Expedia that or whatever it is, there were you want the aspirin or the Tylenol back in the day, or something more not necessarily opioid in because it works, I guess.
Sure,
I mean, I'm stumbling around here, but that so. You didn't want to do that. You don't want to take you don't want to take a bunch of these medications, and your doctor is gone. So then what happened? Well, you're 0 for 3 with the doctors here.
Yeah, I shot out 3. But now I've kept Cyril, and now he's going to retire. That's not fair.
Yeah,
I mean, but he's allowed. But
what happens is, and you mentioned in the last program, we got to reiterate this one: patients don't fall into a venous clinic by mistake, because they have to seek it out. And the way we do this program is to educate you. And there's a lot of other things happening in the vein clinics. We're going to cover them in other shows. But basically speaking, you thank the lucky stars, in your case, Joan, that your doctor referred you to a specialist.
Right, exactly. Yeah. And knew enough to know that he didn't know how to do it, but that's this other doctor would. And also, this doctor that we're talking to here has a remarkable staff. I want to be sure.
I was saving that to last. We don't want to make them feel too good. They're unbelievable.
Unbelievable. Yeah. And the very first thing I did was go have the examination that was really superb. And the woman had flown in from the Big Island to do it, and she's superb.
Now, when you say that, I'm guessing we're talking ultrasound.
Yes.
Yeah. Was that your first ultrasound?
Yeah. Yes, it was.
See, breaking ground here.
That was the first ultrasound you had ever had on your legs?
Ever. On my legs, yes.
Yeah. Okay.
Well, getting back to symptoms, Joan's primary symptom was swelling.
Mm-hmm.
And again, a lot of people, certainly lay people, very, very few of them know that swelling can be a symptom associated with venous problems or other, circulatory kind of problems of the legs. And luckily, again, your doctor, had the insight to know that, swelling does go along with venous insufficiency and lymphedema and all these things, and was able to refer you over. Yeah. But, educating the general public is one of the things we like to do.
Well, that's why we're here.
We're doing
and by the way, please visit Vein Clinics of Hawaii. There's some great testimonials there. There's a lot of fun things you can do there. You want to have some, got a little vanity streak like me. You can do some really need, shave and haircut, 5 cents kind of stuff. But the bottom line is that getting treated for a serious condition, because as we get older, ignoring these things is counterproductive. Okay. So let's talk about that. Your first visit you had a great experience with staff. The ultrasound was the first time. Was it fascinating to you as it is to me when you see the screen and they say that's your artery and that's that's your vein right there that we're looking at here?
Well, that wasn't as easy to see the screen. I was watching the face of the woman doing it.
But that when we said earlier in the previous program, you mentioned that also you'd had other issues, whether it be things that wouldn't heal. We talked about some of the things that we want to talk about. Were any of those present when you finally got to see Dr. Jula's office? Or were they episodically come in and go away? What kind of things were they?
I don't remember.
Wounds I'm talking about.
Yeah, I had some stuff on the forepart of my foot.
Yeah, as I recall, you had maybe intermittent episodes of skin breakdown and ulceration, and I think that we treated you initially with a medicated wrap that we call Unaboot.
Is that like with the silver stuff in it?
Right.
Yeah. Okay.
Right.
Great. I love that stuff.
It's medicated, but again, it's one of those things that primarily work because of the compression. Because again, the swelling is the primary problem, and the swelling is what's causing the skin to break down. So Joan came in. Her primary issue was swelling. After talking to her, somebody comes in. First thing we do is, we talk.
Sure.
And we get a full history. Well, again, Joan is a very, very good patient, and she was able to, list her entire history.
Well, they brought her stuff in. Here I am. And here's my background. Here's what are we going to do here?
Yeah. So she had, we presumed that she had this, underlying this ongoing diagnosis of lymphedema.
Mm-hmm.
We sort of assumed that. So the question for us was then, does venous insufficiency is venous insufficiency playing a role here? And lymphedema and venous insufficiency often go hand in hand.
Yeah, and by the way, Joan, I've heard this a lot since Doc and I started doing the show. A lot of it is simple process of elimination. You test for all of this stuff, and pretty soon the planets are going to line up to be able to make a thorough diagnosis. So was that part of what you learned? And was it good to know that? How did you feel when somebody said...
Well, I felt very good that there was a diagnosis of the venous insufficiency, because then I knew that would be taken care of. See, I still had my doubts. I still have my doubts that they'll ever take care of lymphedema per se. I can't even
You've
read
had it for so
enough.
long, maybe.
I can't
nobody
even
can fix
read
this.
stuff that satisfies me. Descriptive, but not decisive. And whereas with the record of the venal operations happening, I knew that was going to be taken care of. I mean, I saw completion. It's kind of like years ago in 1976, I had a fractured ankle, and I learned so much about how bones go back together again. And I had a wonderful
in some
time.
cases,
Oh, it was great. And I have a very good therapist. I got a great appreciation of physical therapists and things like that. Well, the same thing with this. I knew that it was going to work. I didn't have a doubt. I didn't have a doubt.
Yeah.
And it was wonderful.
That is important because, I guess maybe, Dr. Jewell, if you can explain that if you are participating in your treatment and you're being proactive in it and you are optimistic and you have gains, now you're talking about grand slam in the bottom of the ninth inning, winning the game.
Right.
Getting back to track.
Yeah. With the patient, the role they play in not only diagnosis, but, going through the treatment process. The way that they are approaching that whole thing makes a huge difference. Absolutely.
Okay, so let's talk about that. When you first became acquainted, after your staff had done the initial questionnaire, and now you're going to sit down. I'm to assume that you say, okay, well, we're glad you're here. What bothers you the most?
Right.
Or how do you map out an attack plan for Sister Joan?
Yeah, at that point, the point at which we start to talk about therapy, they have come in for their consultation. They probably came back on a second occasion to have an ultrasound. And then they're coming back, and we're going over the ultrasound. The ultrasound really tells us a lot of information with respect to vein function, and that's what we're looking for on that ultrasound. We not only want to get a good picture of the vein, but we also want to see how it's functioning. And like we've talked about before, veins are the blood vessels that should be carrying blood back to the heart. So veins in our legs should be carrying blood consistently upward on its way back to the heart. When they start to fail, when those veins fail, blood starts to settle downward. And as you might imagine,
here comes the swelling.
That can cause swelling.
Yeah. But Joan, what I think is really important for people, I don't want to say, and it sounds cliche because you are a person of faith, to take a leap of faith into something like this. But it must also have been that you had a goal in mind, and I'm wondering at what point in time did Doc or his staff say, well, what do you expect? Where do you want to go with this? It's not necessarily cosmetic. What we're talking about, it's about your health.
Well, I like what I do. I like my work, and I like the people I work with, and it's stupid not to take care of yourself so that you can keep on doing it. So, and also,
don't pull any punches. It's just plain stupid.
Yeah.
Okay.
Also, I kind of make deals with God. I don't know if I'm supposed to, but I do. Like if you want me to do this work, let's get an answer.
Yeah, make the swelling go away while you're at it. Yeah.
Or at least get me to a point where I'm not going to worry about it or be accused of not paying attention to symptoms, because we've had people in the community that have not reported stuff and got it to such a point you couldn't fix it.
Yeah, and that's where we don't want to be.
Yeah.
Doc, I think maybe we could reintroduce the fact that there are 6 stages of venous insufficiency. And placing somebody like Sister Joan or anybody, it's important to find out where you are. But isn't it sort of interesting, because she told us earlier that there was a history of strokes in her family. Mm-hmm. She knew about that a little bit. Right. So as you get older, you're thinking, okay, well, am I going to start getting the family strokes? And if so, what can we do to delay that as long as possible and get this fixed? So
sure.
How did you feel when you first met Joan that she realized that she could be really a part of this, but what did you see and what did you recommend, and where is it now?
Yeah, well, when Joan came in, then getting back, or you alluded to the classification of venous disease, and the lower classifications, or as the classification stage goes up, the more urgent we feel about treating them, and Joan having chronic swelling with skin changes, and periodically having ulceration, that's a very high grade level of chronic venous insufficiency.
In other words, you've gone right past the halfway mark.
Yeah, we were beyond the halfway mark. And so, we felt like there was a certain amount of urgency. Now, one of the ways that we, urgently treat somebody with ulcer and those kind of findings is, again, with an immediate, some form of immediate compression to relieve the edema in the swelling in the skin. The swelling that you see externally is fluid in the entire tissue of the leg, but the thing that the skin is sort of the end organ of this process, and that's where the ultimate inflammatory and abnormal physiology is going to happen. That's going to lead then to a thickening of the skin, brownish discoloration, ulceration, etc. Everything we do is directed at trying to eliminate swelling, especially at the level of the skin. Okay,
so once again, gang, you can learn this at veinclinicsofhawaii.com. This scale we're talking about, we've talked about it on other shows. It's going to come up over and over again. It's not necessarily the end all, and sometimes it's not like 1, 2, 3, 4, 5, 6, because I think it's sort of like when they do hurricanes, a 1 and a 2 and a 3. The difference is exponentially worse as you go up. So the difference between a stage 4 venous insufficiency or 5, that's a lot. Now you got a real. So let's talk about maybe where Joan was and maybe what was some of the first treatments that were done.
Well, when Joan came in the first time, I believe she did have skin breakdown. So that would be a C6. Mm-hmm. That's the highest classification level. Yeah. So we did the getting back to the ultrasound. We did the ultrasound, and we found out that she did have venous insufficiency. There were a couple of veins, I think, in both legs.
I was going to ask. A lot of times we talk about that. Sometimes one leg is no problem and the other leg's a nightmare. Mm-hmm. But it sounds to me like what you're saying is that Joan's case was pretty typical as we age, having these conditions in both legs. Mm-hmm. Maybe sometimes that's good, because you can see what you're treating or how to diagnose.
Not only can you see what you're treating, but there's something there to treat. And I think Joan was alluding to that before. She was sort of pleased or happy to find out that she did have a vein problem, because she knew that we could impact that.
Could do something. Sure.
Something real.
Getting back to lymphedema, and Joan, unfortunately, you're right. I don't think there's probably in our lifetime going to be a good surgical remedy to lymphedema. Are there things out there? Yeah, there are, but they're not done very often, and the long-term results are not all that great. So we're left with things like compression and that sort of thing. But yeah, that's the frustrating part of treating the type of problem that Joan has. Part of it we can do something about, and a big part of it, unfortunately, we can't. But we try to manage it.
Yeah, what I was going to say, if it's managed and you know it, and I suppose there's some other anecdotal things that you can do to take care of it. But I think that maybe what somebody has to know is you dealt with pretty aggressively taking care of conditions that bothered you. You've always done that. Maybe because it's the love of your work, the commitment you've made to other people, and all of the things you have to care for. You need to be in top Joan shape for these things.
Yeah.
Okay, so what treatment did you have first? After you were diagnosed, what did you have?
Knowing that there was going to be a solution for at least this part of the problem, and it was going to succeed. I mean, I had utmost confidence that it was going to succeed. I didn't think, well, I hope it works.
Yeah.
No, I knew it was going to work.
It's not like pulling the slot machine handle.
Yeah,
you knew you were going to get a jackpot.
Given. No, that was a given. And I think, well, besides the fact that it was a nice setup, it also was a relief that I could get some kind of help. I mean, okay, so you end up with something that's chronic, but it's not as difficult as it was before. I've been more optimistic since, thanks to you.
Yeah. I think that's fascinating. I'm gonna toot Doc's horn for a minute, and that's because we talked about that from the very beginning. The parting gifts that you get with a patient is the patient's comfort. Or the fact that they either said, I did the right thing, or now I can do this a little bit better, so what's next? I want to get even better.
Yeah.
So we did the ultrasound. Yeah. We found out that Joan had venous insufficiency. And then the next step would be to have talked to her about the procedure,
the treatment plan. What's the plan here?
And
what are my options?
So we did that, and then we had Joan come in. Now, so tell us about the experience of coming into the office for procedures, and how did you feel about that?
The 4 procedures were Wednesday, Friday, Saturday, Monday.
Okay.
And I talk about not losing time from work or whatever. I mean, I might have been a little more cautious on the days that the procedures were done, but basically it was a non-symptomatic treatment. So that was one nice thing. I didn't know it was going to be so easy.
Yeah, see, that's the thing. I mean, let's go back to when we first met and talked about this. Some of the other sisters that had the old vein
stuff.
stripping, the pretty rough stuff, pretty debilitating. And voila, you get in for treatment today. First of all, the ultrasound wasn't even available back then. But secondly, they can zero in a pretty non-invasive way to treat your problem. So that's what I want to know. When did you feel better? Immediately?
Well,
I'm talking. What symptoms were treated? Did any symptoms go away after you had these 4 treatments?
I just knew that my circulatory system had been well treated, and that was going to stand me in good stead, no matter what. I was not going to worry about that anymore. Not that I had a specific worry, but I just knew that there were lots of stuff wrong, and it might as well get it fixed. So,
did you feel like now swelling? You probably saw some improvement in swelling. However, sometimes that doesn't. So swelling's a little bit of a tricky thing because swelling can be caused by a number of different things. Often when we do these procedures, the swelling, obviously doesn't go away right away. And also your leg has to go through a certain amount of healing before it starts to eliminate some of that swelling. But there are other symptoms. Did you have much achiness, heaviness, maybe fatigue in your legs?
No, actually it was the most sensory thing. And I think I would have expected a little more pain.
I was waiting for the pain. Didn't happen.
It didn't happen. Yeah. It didn't happen.
I feel like I got cheated. I want some pain.
But before you had the procedures, did you ever feel like your legs were getting tired quicker than they used to?
I guess the word heavy. Yeah. The word heavy is the one that I use the most.
Yeah, we hear that a lot.
Yeah.
Tingly, heavy, burning, cold, hot, all the same thing. But our pain sensors or our sensors perceive it differently, is what you said, right?
Yeah, sure. Yeah. So do you feel like the heaviness was addressed after your procedures, which is a symptom that you may have seen a change in a little more quickly?
I probably didn't pay enough attention to answer that question appropriately.
Yeah.
What I did know was that what I did coming to your clinic was the right thing. I was convinced it was the right thing, and I think that was important for my own healing.
Yeah. So we for Joan, we did something called radio frequency ablation, endovenous ablation, and the way that we treat venous insufficiency these days, like you alluded to before, Mike, is much different than it used to be. Back in the days when we were doing surgical vein stripping, people were in the hospital several days. It was a general anesthetic. There were a bunch of incisions all over the legs, and it wasn't a very palatable kind of way to treat the problem. But yeah, today we have people come in. Most of the procedures we do are an hour or less.
In-house, in and out.
People come in, they have the procedure, they have a little gauze wrap on their leg and their, the infamous compression stocking. And then they leave and go on with their day. But the way that we treat venous insufficiency these days is to do, like I say, ablation. There's a number of different ways to do it, but the ultimate goal is to actually close the vein down that is not functioning properly. And the reason we close it down is because we just don't have the technology right now to surgically repair those veins.
Knock on wood, that's coming down the road, but it's going to be a while.
It'll be a while, but I think at some point we are going to be able to repair those veins. The primary problem there is that there are many little one-way valves in these veins that keep the blood moving in the direction that it should go. And the thing that happens is that those valves fail. And
they're tiny little things.
Yeah, they're very tiny, especially in the veins that we're working on. But do I think that at some point in the future there's going to be a little silicone whatever we'll pop in there with a little wire? Yeah, it's probably going to happen.
But the thing that I think is most important and the takeaway that I hope people get is that you had this expectation. But I think that also, let's talk about some of the things that you did because they made sense. I'm talking about before you saw Dr. Julep a long time ago. Did you, say, practice on a regular basis elevating your legs? Did you think that this was a good idea?
I've never bought into that, and I better.
It's high time, Jim.
My wife, bless her soul, she'll always say, so I suppose you're going to build a mountain. And I say, yes, I am. I have this little routine. And I think that if you're going to watch a television show before you go to sleep, a couple of hours or an hour of having those legs up in the air.
Oh, yeah.
And then having a nice sleep,
I have just inherited the use of a marvelous recliner chair.
There you go.
Sister Rosaria. And I get first dibs on that.
So good.
That's going to help.
However, here's the thing that I learned. For it to really be of value, most of the time, your feet have to be higher than your heart.
Exactly. Exactly. And
it's hard to get out of some recliners.
Right. Well, it is. And the actually the best way to elevate your legs is really to have your body flat and your legs up on 2 or 3 pillows. So if you're flat in bed or flat on a couch, but unfortunately, Joan mentioned this before that. For some people, it's not all that comfortable to lay flat on a bed or on a couch. But you're right. The key is to have the legs above the level of the heart. That's the only way all of that swelling is going to be resolved.
Okay, I come from a family of inventors. Really, seriously, my grandfather was an inventor for Singer, and I think there should be a trapeze at the end of a bed, and 2. For want of a better word, something like stirrups that would hold your legs up. Because if you put them on the pillows and you happen to move sideways, they go off, or the pillows move. And this would be, and then you would have the television set above that thing, so you'd be there with your feet up and you'd see it. And I would like to design that. I'll draw it, somebody else can make it, and I think that would be a lot.
I'll tell you what, it'd be a lot more fun to work on that than the George Foreman hamburger cooker. This would be. But I think that everybody has a different way of dealing with this stuff.
Yeah.
And I feel like what you were talking about earlier, this expensive contraption that was so limited, and it took away your time. I think that the elevation thing, every now and again, some people used to think about it. I do it here sometimes in my other office. In the couch, I'll just lie down and put my legs up against the wall and think, hey, for 10 minutes of this, and now I'm going to walk down to the store to get something to eat. I'm running like a racehorse. I think that you need to have those little me times.
Yeah. Well, that's true. Especially for lymphedema. There's really only a couple things, unfortunately, that we can do. They're both mechanical. One of them is compression, and unfortunately, especially in a state like Hawaii, people have a hard time wearing compression stockings all the day. But
when I see them now, I see them, Doc, all the time. We talk about this because they're coming out in neon colors for sports people, not to treat venous insufficiency, but to increase their stamina and not get their legs tired.
Right.
But I think when I see somebody wearing them now, I think to myself, that's a smart lady or that's a smart guy, because I wear them every day.
Yeah. But in addition to compression, getting back to what you were saying before, elevation can be tremendously effective. Yeah, I mean, and I think people sort of discount elevating your legs as a mode of therapy, but it definitely is. You're using gravity to get rid of that swelling. I
think, and Joan, you hit on something earlier, which I'd like to get back into for a minute, and maybe Doc can explain it. We always worried about, as we age, traveling. Traveling is really, really bad for circulation. If you're on an airplane for 10 hours and you're not pumping doing the things that you got to do, getting up and moving around. But you brought something else to the table a while ago, and I hope that we can repeat a little bit of it. And that was that there was, even though you didn't know if there was a lot of cases of venous insufficiency in your family because you didn't, because of the time you left, but you did know about strokes. And I think, Doc, strokes are the next thing that happens, really. If you have a bad blood clot, can't you actually get a stroke because of that?
Well, typically, the answer to that is yes, you can. But usually those are two different problems. Venous clot formation and the some of the bad things that can happen there. Usually it's not stroke. Stroke is usually an arterial problem.
Oh, okay, that's good.
So usually two different things. But the thing that we get concerned about with respect to venous disease, and people with venous insufficiency do have a little higher risk stratus for developing blood clots, DVT, deep venous thrombosis. And the thing that happens there is that clots form in the deeper veins of the leg. They can break loose, move, go through the heart, and then end up in the lungs.
In the lungs, and
that,
worse.
That can be a fatal event. Sure.
Yeah, and nobody wants to do that. I must really admire Joan for being willing to come and talk with us and share herself, because I think that there are so many people listening that if it's not them, it's their mom or it's their grandma, and they just say, you've taken care of so many other people for such a long time. Why don't we see if there's something we can do that you maybe not have to have that cane, or maybe you won't say, oh, I don't want to go to the mall today because my legs are too sore. It doesn't look like you're missing a beat on anything. You're just not going to do that, are you? Yeah, I mean, I clearly get that.
Yeah.
So let's talk about what's ongoing. So we just talked about it. You had 4 appointments so far, right? 4 procedures.
4 procedures.
Okay. Over in all of a period of a week?
Less than a week.
Yeah.
Less than a week. Okay.
Yeah. The follow-up is
that's
important.
Let's talk about the follow-up.
The which is one of the things I think that before we had the newer devices, back when we were still doing, vein stripping, I think that we probably weren't very good at follow-up for venous insufficiency. We didn't really follow the patients the way we should have. So consequently, a lot of those people that were treated surgically in the past, they're coming back now, and we're seeing those people and having to do some further work on them. But the way that we like to follow people is by doing periodic ultrasound.
Yeah, I was going to say, the ultrasound operator, and Joan, you made mention of it before, how impressed you were with the gal. And I want to tell you something. If you have the same person, even if it's a different person, but if you have the same person, there is excuse the expression, day and night difference in that leg, isn't there?
Oh, yeah.
When you've done a treatment and gotten rid of those rascals, now what you're seeing is the blood found a new way to move around, and you're not getting that swelling and you're not getting that pain because you've attacked the veins that used to cause those problems are gone.
Mm-hmm. Yeah. The reason that we do follow up ultrasound is to, number one, make sure that, what we've already treated is still stable, status quo, make sure there's nothing, amiss with that, but also to make sure that there aren't new issues coming up.
Exactly.
And venous disease is one of those things that's, most of the time it's a genetic predisposition for people to develop, vein problems. And when people come in, we're fixing the problem that they have right at that moment. We're not changing their genetics.
Yeah.
So,
but when we talk about that, and everybody looks at, okay, what's on my list? What do I want to do? Joan hasn't stopped one iota. She's traveling internationally, in her mid 80s. It's got to be a testament not only to you're willing to participate in your own treatment, but that you have this level of confidence now going forward. So, I'd love to be a fly on the wall and see that follow up ultrasound. So that you can see. Yeah, come on in. And just
I won't hide it.
Yeah. But isn't that part of it? You're willing to share this. I'm blown away. I hope that there's people out in the audience that have themselves or their parents or their neighbors or their church member or their teacher or their banking lady or whoever. You can see now. I imagine that you're like me, see a little bit more positive stuff. And Doc, isn't it also true that after you have your treatment, you can notice it in others? I notice in other people, I think that person's got a vein issue. I can just tell.
Oh, yeah. It's hard not to talk to people when you walk through Walmart, definitely. But we have found that if we do adequate follow-up in people, might we, again, since it's a genetic problem, which is ongoing, might they have additional problems in the future? Well, they might. Yeah, they may have different problems. But we have found that in doing these periodic, we call them surveillance ultrasounds, we find that we're able to catch things early so that they don't have to go through as extensive procedures as they did before, and just kind of stay, maintain the status quo and maintain their circulation at an optimal sort of level, which is what it's all about. That's what we need to do.
Perfect to learn that. And there's something else. I want to go back to something else that you were talking about before in your history, Joan, where you were looking at, being in the hospital for days when others were. And maybe this is better for Dr. Juleff. If you were to do the same thing that was done before, in this day and age, in the cost of medicine, being in a hospital bed or having these big procedures, they would be, I would imagine, just financially not doable.
Yeah, they probably would be cost prohibitive. Yeah.
So maybe you can talk about how, when you assess somebody, how you can find out. And Joan, you said knock on wood, you got a great health plan. That's a blessing, to make sure that the health insurer knows the importance of these people having these procedures that we're talking about.
Yeah. Well, luckily, 95% of the stuff that we do is covered by Medicare and most insurances. But we always, part of the process of evaluating a patient is to make sure that their insurance does cover it, so that there aren't any surprises. Luckily, venous insufficiency in general is a covered, disease process, and we work very, very closely with all the insurance companies, and make sure that we're doing everything right.
Yeah, Joan, is that comforting to you, knowing that your insurance realizes that you have not just self-worth, but you have things that you'd like to do, and that you'd like to do them without pain?
Yeah, no, I appreciate the insurance system that we have now. I mean, and that we're lucky. We're so lucky.
And that being said, and since most of this happens, and now I know it's by the time people are hearing this, they're still in this great sign-up period. So many people are so confused, particularly some of our seniors, in what should I do this, what I should do that. If you're working, there's no change, correct? Most of us, if you're past retirement age like I am, but I'm working,
right?
I don't need to worry about that other stuff.
Exactly.
But how does the insurance company, or how does Medicaid step in for that?
Well, once you reach a certain age, which typically is 65,
right.
Then you're eligible for Medicare. And, the Medicare in general will cover 80% of the cost of, a visit, procedure, et cetera. And then the patient is responsible for that other 20%. And now that other 20%, however, can be covered by what we would refer to as a secondary insurance. That's something that the patient themselves, however,
would elect. It's elective.
It's elective, and that's something that they have to, personally organize and purchase, outside of Medicare.
There's a lot of advice you can get on that, folks.
Yeah, and it's it's complicated, and I certainly don't understand it all either, but. And unfortunately, this time of the year it's always difficult because so many people have so many questions. But
plus that you get plain scared. I mean, I open my mailbox, stuff's come flying out of it. You only got 2 days to do this, then, and so I talked to my advisor. He said, "You don't do any of that. You don't need anything.
That's good."
But however, I do know that holds some people back, and in the case of. If somebody is retired on a fixed income and they don't have the same kind of health insurance.
Well, I think in general, with respect to the treatment of venous disease, I think a lot of people assume that it's not covered.
Yeah.
And that's another thing that we try to educate people of, that by and large, most things that we do are considered medically necessary and are covered by insurance. Now, with respect to, we were talking about follow-up, and, the follow-up for the venous part of it is ultrasound and making sure that there's nothing more that we can do with respect to that. But, there are other ways to, continually monitor and treat ongoing lymphedema, aside from just what you're doing at home, which is compression and elevation. But, a lot of physical therapy organizations these days are taking kind of a leading role in the ongoing treatment of lymphedema. And luckily, although, like we talked about before, I don't know if in our lifetime we're going to find a surgical cure for lymphedema, we are, I think, paying as a country much more attention to lymphedema, and we're slowly devising ways to better control and treat it. And it's we were talking about your treatment in Germany that included massage for your legs, and lymphedema massage now is becoming a very big modality in this country. And I think that's one other thing that people can do to make an ongoing impact in the overall status of their lymphedema.
My question would be, and I don't know if you feel this way, Joan, but I do, and that is, all right, I got lymphedema. There's not much that surgically I can do, or not many pills I can do, but I also have venous insufficiency. And if I get rid of that, at least that is one less thing to worry about, but it would also maybe make you a little bit easier to handle the lymphedema.
Exactly. You nailed it right there.
Yeah.
Because that'd be the key for me.
That's the crux of the issue. Yeah. We see many people with those two problems together, venous insufficiency and lymphedema. Venous insufficiency we can do something about, and typically if it's a significant amount, we will treat it because we want to get their circulation optimized as much as possible, and in so doing, then the lymphedema and the swelling will be more easily treated.
Okay, so what you're going to do is you're going to go to www.veinclinicsofhawaii.com and check out some of the things we've been talking about. Click on a few of the things and then make an appointment, because what I'm looking at now, and I don't even know if it's certainly not in Dr. Juliff's term, but maybe in my own, and maybe in Joan, is that, I've been treated. Okay, the venous insufficiency that I was suffering, those veins have been treated. Right now I'm okay, but I want a management plan. I want to know that I want to nip these things in the bud. I don't want to wait until I have to come in and have forced procedures. I want to walk in, get an ultrasound, say, can we fix that one Saturday? I'm out of here. Or I want to travel. How many people are now asking, you're going to be traveling again pretty soon, right? And now, does that give you a more positive feeling of, I don't have to worry when I'm traveling because I'm in good shape. I feel good.
I learned that I'm a great devotee of sleep. I'm a very good sleeper.
Sleep is good.
I can sleep on a picket fence. And I once got on I could do it anytime. I get on a plane. They used to have a blanket, put the seatbelt over the blanket.
Right.
I could be asleep before the plane took off.
Wow.
And sleep until the wheels went down when it was going to land. And one time I had this just absolutely gorgeous guy sitting next to me, which I didn't know because he sat down after I was asleep. And when I woke up, he, in this wonderful Southern accent, he said, "Ma'am, I'd be so appreciative if you could teach me how to do that."
And you said, teach what?
And I knew what he meant.
Yeah, sleep.
And I said, well, I could be a millionaire if I could teach you how to do that. But I think the problem is my legs aren't as long as yours. And so I can pull them back tight. And I don't know if it's the right thing to do, but I always pull my heels back as opposed to trying to push them forward. And somehow or another, it's made me a very good sleeper on a plane. So,
Doc, I think, Doc, normally you say, wait a minute. I don't think I want to hear this because it's counterindicative now it's indicative now is you're better up getting up and walking around the cabin. Now, they don't like you doing that.
No.
But we also said the pump of the ankles if you're doing this. But if you're sleeping, if you are in venous insufficiency bad, isn't sleep really bad to do when you're flying?
It probably is.
Yeah.
Something happens when you sleep, I think. There's a wonderful French poet, Charles McGee, who said, God loves the man who sleeps. God says, he lets me run my universe at night.
Yeah, that's really good.
I love that.
The thing is, you must be living right to be able to sleep well. Yeah. Because you must be able to empty out that corruption up there in the brain and to say, I'm going to sleep. I don't want to think about any of this. Good night.
Yeah.
And there's like people with sleep apnea and with all of these other things that also are with type 2 diabetes, with lymphedema, with venous insufficiency. I mean, they're virtually a train wreck.
Yeah. I think sleep. We probably don't understand how important it is to our overall general good health. Because people who sleep well are healthy. There's no question about that. But on an airplane, especially people with venous insufficiency, there's a real threat of DVT, and it probably like they say like you read in those magazines on the airplane. You should be exercising your legs, getting up and walking, maintaining good hydration.
So that's what we're going to work on next time. We're going to get Sister Joan sprinting up and down the aisle, sprinkling, pixie dust on everybody that wants to take a nap. I want to tell you how much, on behalf of our audience, Sister Joan, that we appreciate you being with us and continued success. And we look forward to seeing you again. And Doc, that's a great way to sort of categorize a typical patient who finds their way to Vein Clinics of Hawaii and just says, you know what, I'm not going to put up with this stuff anymore. I'm going to stay a little healthier than that.
Yeah. Joan was a great patient because she did her part well. And, the outcome, I think, has been very positive, and that makes us feel good, too.
And I tell everybody I know that they should go.
Good, and that's a fact. And that's what we're going to leave it. As a matter of fact, I want you to go and check out the website. Vein Clinics of Hawaii on 4 islands, Maui, the Big Island, Kauai, and here on Oahu. Dr. Juleff is the medical director, and you will get just the best treatment. There's a lot of other fun things, too. In a future show, we're going to talk about that. But if you want to know right now what's going on, come back again next time. In the meantime, get to www.veinclinicsofhawaii.com. So for Dr. Juleff and Sister Joan, I'm Mike Buck. Thanks for being here. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.